Good morning, everyone. How's everyone feeling? It's me, Dr. EVA Okindaya Apia. Good morning. Good morning. Okay, how's everyone feeling? Okay, let me know that you can hear me and see me well. Let's see. Okay, let me pause this for a second. Good morning. So, today's topic, we are going to go over the ultimate health plan for the professional woman. And it's going to be a lot of fun. It's going to be a whole lot of fun. Now, remember, this platform is really for us. Again, my name is Dr. Ibiye Okindaye Apia. By trade, I am an internal medicine physician and also a kidney specialist. And, my area of interest is really women's health. And part of the reason I started this platform is really because of the pandemic. And I'll get more into that in just a little bit. Okay. I'm just gonna do like a sound check. Oh, hi, Ebony. Good morning. Ebony pronounced Ebony. I love it. Beautiful picture. Okay. I'm just gonna just check my sound just a minute just to make sure everything's all good here. Check my sound. Okay, perfect. Good morning, everyone. Oh, thanks, Ebony. Okay, perfect. So we're going to get into a lot of topics. I had mentioned earlier that the title of this is the ultimate health plan for the professional woman, and a lot of you may be professional women. And by the way, this is not exclusively for women; it also can be relevant to men. So I just want to spend the next about 45 minutes to an hour, and we're gonna get into some things, including my personal life. So you can ask some questions, but I also will give you guys an opportunity to be able to call in as well. So we're going to have some fun, okay? Um, Again, my name is Dr. Eva Okindai Apia. I'm an internal medicine physician, nephrologist, or kidney specialist. And actually, my area of interest as it relates to my research is how to improve outcomes for women with chronic kidney disease as it relates to pregnancy and fertility. So that's really my passion. And I'll get into that in a little bit, but let me just let you know that for the next like 45 minutes or so, I want you guys to be able to follow along. I have a little presentation for you all. So let me just pull that up. Okay, so hopefully you can actually see that. Let me do a check. Okay, perfect. Perfect. So you guys can see my screen. So the professional woman, the ultimate health plan. So let's just go ahead and get started. And again, remember, feel free just to comment in the chat, or I'll even leave some time at the end for you guys to call in and ask some questions. Hey, Bishop, thanks for joining. You guys, Bishop Red Pill is an incredible YouTuber. He actually has an incredible platform to try and encourage masculine traits in, young boys and men. And so I definitely urge you guys to follow him on his channel. And I wanted his perspective as well. So make sure to sign up on his channel. So thanks for the support, Bishop. So let's go ahead and get started. The professional woman and the ultimate health plan. Okay, so really, I was reflecting a couple of days ago, and this actually is the inspiration for this topic. Okay. So, I feel so lucky. I have a career that I love. I see patients, I do research, and, luckily my personal life is also flourishing and blossoming. And I don't take that for granted. I will say I'm young still, okay? I'm a young woman. I'm not going to tell you my exact age, but I will say I'm in my early 30s, and that's all I'm going to give you. And a lot of my friends are. In fact, at my wedding, I had like 8 bridesmaids, and I think 6 of them were all physicians. Okay, and so what am I trying to say is that there are unique issues that professional women face as it relates to love, relationships, and kind of life planning as it relates to, um, you know, getting married, potentially having children. For me, I'll say for me, I spent a lot of my youth in school. My parents were strict too, so I didn't get into the whole dating thing and relationships. I was focused on school, going to college, getting into med school. That was my priority, and so a lot of these things I never really spent too much time thinking about until later on. So I wanted to share with you as a physician what I've learned dealing with other women, but also as a woman myself, as a professional woman myself. This is not just for um, only physicians. This is for any professional, and I'm talking about like nurses, executives, accountants, business people, engineers. That's a big one. And anybody, and by the way, I don't mean you have to have the most degrees. This is for anybody. And the men or women that love and support them, encourage them. So I've learned that, you have to consider a contraception plan. So if, having children is something you desire, that's great. But for a lot of women, they want to decide to postpone dating, relationships, and possibly pregnancy until after their careers have been set or gotten to a certain point. And I just wanted to touch on a couple of things throughout this PowerPoint. So mainly, these main topics will be contraception, planning, when are you most fertile during your menstrual cycle? That's a big one. STD prevention, and a couple of other things, and even some egg freezing topics. So as it relates to contraception, this is what I will say. Hey, Tony Robinson. As it relates to contraception, there are a lot of different options. The contraception that we have in 2021 is different than our mothers' and grandmothers', contraception. It's beyond just a condom, and I'll get into that in a minute. And really the goal of the contraception is to prevent unintended pregnancy. Now, caveat, there are a lot of women who are on contraception, but not necessarily for pregnancy. You guys may have seen in like middle school, high school, I know some of the girls that I was friends with, they were on contraception also for skin issues as well, or some other issues relating to irregular menstrual cycles. But ultimately, overall, contraception is a medication to help you prevent from pregnancy, and they each have their own risks and benefits. Talk to your doctor about it. Okay. The next thing I will say is that pregnancy in the life cycle, okay, and the cycle, meaning the menstrual cycle. What I will say is, bottom line, you can get pregnant at any time. A woman can get pregnant at any time. However, there is a key period where you're at increased risk for pregnancy. Okay, so hope you can see my screen in my arrow, right? So during a calendar year, let's say a calendar month, there's about 30 days, right? And let's assume that a woman is menstruating in the first week. So that's the first 7 days here. So after a woman menstruates, the 2-week period after her menstruation is the time that you're at increased risk for pregnancy. And this is the time you're most fertile. It's complicated as to why that is, but it has to do with the hormones and when they rise and fall and when an egg is released. So ovulation is release of an egg from the ovary, and that happens typically around this time period, around day 14, assuming a 30-day cycle. So around day 14, or right smack dab in the middle, is when an egg is released. I will say that um, you can get pregnant during this time period because when sperm enters the reproductive tract from sex, it can live in the body for some time. So as long as there's overlap at some point, the egg can get fertilized by the sperm and create a baby, all right? So remember that right before your menstrual cycle, the hormones change, and so you're less likely to get pregnant during this time period, but the 2-week period, again, after a woman's menstruation is key. So, this is not just for women. Hey, gentlemen, just keep that in mind. If that's your goal to get pregnant, that's the sweet spot. Okay. But if your goal is to avoid pregnancy, that's the sweet spot to potentially avoid. And I think sometimes it's just good to be aware of that. This is not common knowledge, guys, but I want to be able to share with you based upon my medical knowledge and what we know from science. Hey, let's use science to our benefit to get what we want. Okay. So next, I took these schematics from a couple of papers, to show you the different types of contraception. Again, there's a variety that are safe. And the first point I want to make is that, the pill is probably the one that you guys are most, aware of. So the pill oftentimes contains estrogen and progesterone. These are key hormones that help regulate the cycle, the woman's cycle, and plays a role in pregnancy and preparing the body for pregnancy. So basically the pill, this is something that's readily available. It's relatively cheap. And you just pop the pill in every day and you move on with your life. Now, the caveat is that you have to remember it every day. There are also patches, there are rings you insert into the vagina. There are different ways to do it. A common way is to leave it in for 3 weeks and then take it out for a week. The negatives of a vaginal ring is that sometimes women have said that they do feel it and it can be uncomfortable, number one. The second thing is sometimes during intercourse, men can actually feel the ring and it can be uncomfortable. And so some women are concerned about that. That's a common question. The other thing is sometimes people forget whether or not the ring is in or it's out. And so just be aware of that because if it's left in too long, your body can get irritated as well. Now, there are also different kinds of implants and injections. You may have seen the implants, there's some like commercial where a woman's like, showing her arm and showing the implant in the arm. So those are ones that you can get in and they slowly release the hormones in the body to help prevent pregnancy. There are injections that you can get periodically as well. I do like IUDs. IUD stands for intrauterine devices, meaning within the uterus, okay? And I showed an example of a schematic here. This is just an example of Mirena. I'm not promoting Mirena. I have no affiliation with them. It's just a common one. So it's basically a T-shaped device that's inserted into the vagina, into the uterus, and it slowly, basically, it helps to prevent pregnancy by some of the mechanisms described here. It increases the cervical mucus to prevent sperm from entering. It thins the uterine lining. And basically inhibits sperm from reaching a fertilized egg or from being able to fertilize an egg. What's cool about the Mirena is it's kind of like a set it and forget it. I talked about that on a prior live. So you can put it in, people can have it, depending on the kind of IUD, it can be in there for as little as 5 years or even longer, 7 years, 10 years, depending on the kind and what's going on. But again, your doctor will help direct you. So unlike the pill, where you have to remember to take it every single day at the same time. Remember, same time. The Mirena is something that you can get in and you leave it and forget it. The negative, though, is that it's a procedure. I've actually helped place these in medical school in some women, and it can be painful, requiring even some anesthesia. But it's a procedure. But once you have the procedure and go through some of the discomfort or pain, I think it's a really good option. I just want to mention for oral contraceptive pills that one key negative is that it really shouldn't be used in smokers over the age of 35. And there are some concerns in certain conditions, including lupus, diabetes, hypertension. And I won't get into the science behind that, but I pulled this table from a Halandovich and Bergner paper. This was a paper that looked at reproductive health issues for kidney disease, and that's my area of interest. So that's how I came across this particular table. But there are different kinds of contraception with pros and cons, and I just wanted to mention that smokers over the age of 35, there's data that suggests there's increased risk of clotting, and we don't want people to have stroke. So that's the caveat, and I'll just leave it at that. The next thing, any questions about what I'm saying? That's a lot of information. Thanks, Bishop. That's a lot of information, but here's the key for women and things that we just have to remember. Our fertility is not forever, right? You guys have heard of the scenario of, okay, our time is ticking. There's a biological clock. There's science behind it. And sometimes we forget how that actually came about. But, I got this chart, and this is a common chart that can be looked up. You guys can look it up. But what is the odds of having a natural pregnancy within 12 months at certain ages? So as we age, the risk or the chance of getting pregnant in the next year actually decreases. So, generally women are most fertile late teenage years, early 20s. This is when we have the most fertility, generally over about 85%. But as we age, even 25, 29 is young, but it drops off. Age 30 continues to drop off, and 35 definitely drops off, okay? And it's not just a pregnancy. The question is a healthy pregnancy. There's also additional data that suggests that the risk of having pregnancy complications also increases with age. So remember, it's not just about getting to the finish line. It's also about getting to the finish line in a safe manner. So we want to be able to have, for those who desire a pregnancy, we want to be able to have a pregnancy, but also a safe pregnancy where the child is, happy and healthy. The next thing I want to show is that the ovarian reserve decreases as we increase in age. And I'll just show that overall the trajectory is lower, that we're born with a certain number of eggs in the ovaries, but as we age, they decline. And also keep in mind that every month, for people who have normal function, an egg is released. So it's not just about the ability to get pregnant, but what reserve do you have? And that's an important point. And remember that it really starts to drop off 30, 35, and certainly 40. And I'll get into that in a little bit. So I'm a sexy blonde, hey. So I'll pause there. So I think there are a couple of key questions that we need to ask. And actually, for women, especially professional women, or who are geared towards, their career, we have to ask, do you want children? Do you want children, and when? Okay. Next question also is, do you want to be married or be in a long-term committed relationship? And the reason I say, do you want children first, I use that, to me, that's one of the most important things. It's not just about your partner, but I think one of the most important decisions you can make in your life is who you have children with. And they're not necessarily the same for many reasons, right? Families are built in different arrays now. We have beautiful blended families, and families that we choose. But I think it's important because the person who you have a child with, if you're a woman and you decide to have a child with a man, you know, you're tied to that person for almost basically life, or at least to the age of 18, depending on the kind of parent you are. And with marriage, you know, statistically, we know that about half of marriages end, unfortunately, in divorce, and it may not be for 18 years. So what I'm talking about is, you know, children are really forever. If you have a child with someone, that's a lifelong commitment, right? Um, versus a marriage that statistically may or may not be forever, and we hope it's forever, but it may not be, just based upon the numbers. And there's a lot of reasons for that. You guys know, I think the common two reasons for marriages not for divorce is finances and infidelity. And we don't hope that on this channel, we don't wish that, but I'm just saying, let's be prepared and aware of the issue. So for me, as a provider, as a clinician, I think it's important to note that for me, children is actually, that decision is maybe as important, or if not more important, than who you marry, to be honest with you. And because it's for the rest of your life, and there's a lot that goes into it. Your body may never be the same. The conditions that happen pre-pregnancy may be different post-pregnancy. Okay, so there's a lot going into it. I want to be clear, they're both extremely important, but remember, this is an important question. So yes, if you want children, let's plan for that and how to do it. If you're thinking, no, I definitely do not want children, then we have to come up with a clear contraception plan. And we talked about that earlier, the kinds of contraception. Now, if you're thinking of maybe, not sure, maybe yes, you need to come up within your mind, what criteria are you using to make that decision? Are you thinking financially? Are you thinking the emotional turmoil? There's a lot, obviously, that goes into if you want children, and of course, by whom. So I'm not going to get into that, but my point is that I feel that every woman should make that decision, kind of try and make that decision early on. It's never too late to make this kind of decision, but it's an important one so that you can prepare yourself, okay? My next question is, do you want to be married or in a long-term committed relationship, or something of that sort? Because not everyone is able to get married, right? Depending, you know, on the situation. So again, it goes back to the previous question. If you do not want children but do want marriage, so this is kind of a chart here. If you do not want children, the left is no children, but the other criteria of marriage. The right is if you do want children. So I'll focus on the left here. If no children, but you do want to be married, you want to be married but no children, you still need to talk about a contraception plan. Go back to what I said earlier. There's a variety of ways to do that. However, plan your social life. I'll speak for myself, you know, as a woman, as a professional person, you know, we oftentimes put so much energy and planning and preparation into the tasks that are needed for our career, but we just kind of give up when it goes to relationships. No, plan. What is your social life going to be? Do you need to go online? It's not, being online and online dating doesn't have the same stigma. That's like normal. Meeting people on IG is normal. Right, Bishop? Thank you. So if that is something you desire, we have to have a robust social life in addition to our professional pursuits. That's number one. If you do not want marriage and do not want children, then again, the contraception needs to be discussed if you're sexually active or could ever be sexually active. Now, if you do want to be married and you do want children, which is good, you still may need to consider contraception because timing is key. Now, I spent all of my high school, all of college, all of my 20s to my career, literally all. Again, oh my gosh, hey, Princess, I almost said my age. I'll just say again, I'm still young. Okay, well, I'm still young, right, guys? But again, I honestly, I was talking to my best friend about this, that I literally don't even remember what happened between the ages of 22 and 26. That's when I was in med school. 21 to 21, 22 to 25. That's when I was in med school. And I graduated, oh gosh. It was just a whirlwind. I literally there are years I honestly don't even know what happened because you're so committed, right? So my point is that you may want to consider contraception if having a child is not the right time at this point. Again, if you want to be married, what's your social life? How are you going to meet your man or woman or whatever you decide? How are you going to meet that person? We have to also plan for that, okay? Next, if you do not want marriage, but you do want children, bingo, egg freezing, or the medical term cryopreservation, okay? So, and or IVF, in vitro fertilization. Egg freezing is basically the benefit about egg freezing, okay, is it freezes the quality of your egg at that point in time. So let's say you're a 35-year-old woman, professional woman, you are not married, don't want to be married, but you want children. Consider egg freezing. Because what happens is that you get eggs at the age of 35, and if you decide at the age of 40 to have children, you are using eggs from the age of 35. And we went over the data a few slides ago that as you age, the quality of the eggs, preservation of the eggs actually goes down. So you're capturing the maximal quality of eggs at that time. I hope what I'm saying makes sense. Okay, I hope what I'm saying makes sense. I'm just going to pause right there. I'm going to pause right there and see what you guys are saying. Um, yes. Okay. So thanks, House of Princess. So House of Princess, she has her own YouTube channel. Definitely follow her. She's amazing and has an amazing makeup line. So she says having children makes it really hard, though a proper support system is needed. Absolutely, absolutely. I'm sure I agree. I don't have children, but maybe House of Princess, you can give me some advice, okay? Then you were young when you graduated. I was. You know, I went straight from high school to college and then college straight to med school. A lot of people actually, do you know what a lot of people do? Oh, let me do it this way. Okay, so what a lot of people do is they actually take some time off between college and med school. Like they may do a master's degree or they may work for some time. For me, this is just for me, I knew I wanted to go into medicine and I'm like, why delay the inevitable? Let's just get it done, get it popping and move on. So, you know, my life is it's different. The way I see life is just different. And you know, people who are like really career oriented or become career oriented, like they just have a different vibe and a different point of view because like my entire life I've really been surrounded in academia. I've always been associated with some university, always around basically people who are doing the same things I'm trying to do. So now I'm still young, but now is the first time that I really have like friends outside of the academic, like medical world. I hope what I'm saying makes sense. So where other people may have had like several long-term relationships, I haven't necessarily had that in the same way because I'm always going back to a particular goal and it's a high stakes goal. You know what I mean? Like for example, in my med school, I went to University of Wisconsin. In my med school, if you do not pass a particular test, you can't move on to the next year. Like you cannot. And if you fail the next, like you may have to repeat that whole class the following year. And if you fail that same test again the next year, you can't go to medical. Like, that's a wrap. You will not graduate. And there's usually like no exception. So it's like high stakes. You cannot not pass. Do you understand what I mean? It's just crazy. It's crazy. So and that's not to say other careers are not important. All careers are important. I'm just saying, women who are really professionally inclined and who have high stakes, that they need that level of commitment and dedication. I made that decision. I wasn't going to be in anything serious romantically until I have secured my career up until a certain point. So that's a little bit about me. I'm spilling my business. But like I'm saying, like the other girls that went to my college and stuff, or who went to my high school, they're like 21, 22, meeting someone, having kids, and so their mindset is just different because they've experienced certain life issues. Like they know how to deal with their man acting up, or lovers quarrels and stuff like that. I don't I don't even, until like more recent, I just can't relate because I just don't have the time, and I don't want to invest the time. And a lot of I won't get into my personal business, but I hope what I'm saying makes sense. It's a different mentality. And so for some, not all, for some, those women who have experienced certain aspects of life, they have like a higher emotional intelligence, or like street smarts, than some of the book smart girls. And I'm not saying in all situations, I'm just saying it's a different perspective. It's a different life experience. And the more you go through it, you learn, and you get the tricks of the trade. You know what I mean? So for me, in my experience, I didn't do any of that kind of stuff really until I met my husband. And I met my husband at the very end of my residency. And I'm just so grateful that it was at that time. And now I'm married, about 2 years in. So these are things, these topics are things that I'm going through right now. And I just felt like, hey, I can't hide this. I can't just keep this for myself. It's really relevant to all of us. You know what I mean? And for the support system that's encouraging these young women just to think about these topics. So poison nosologist, how long is the egg life in freezing? Really indefinite. But the question is, when it's not the issue is not how long are the eggs good for. The issue is how long do you, as the individual, want to have those eggs. Like, some people decide, like, actually, I don't want children. I'll just keep the eggs in the freezer, and that's it. And there are also legal things that you can work on. The other thing is, people's situations change. Like, maybe you're married, and then you become divorced. Do you have eggs in the freezer, or do you have embryos in the freezer? Meaning both mom and dad combined, as opposed to just you. Think about that. So if you're not in a stable situation, like if you want to have egg freezing, or you want to do this kind of assisted technologies, and you're not sure of your situation, consider egg alone freezing, meaning the woman's component only, as opposed to combined. Now, I've actually spoken to fertility experts at Stanford about this. Stanford is where I did my my fellowship training in nephrology, and I remember inquiring about the difference academically between embryos and egg preservation. And the thought is that an embryo may have a higher quality than eggs alone, but if you're not sure of your situation, you may want to just consider eggs alone. But very good question. Indefinite, last indefinite. Makes sense. Thanks, Bishop. Thanks, poisonosologist. You're so sweet. Thank you for joining. I'm so glad you're here. So I just want to finish up. Let me share my screen again. I just want to finish up with the last few points. as a summary here, let's see. Okay. So a couple points about egg freezing, and we talked about this as well. This is to me, this is like wearing your seatbelt. This is like getting an insurance policy. Hopefully you don't need it, but in case you need it, you have it. The benefit is that you're freezing the quality of the egg at that time. Younger is better in terms of quality of the egg. Um, so you're more likely to have a successful pregnancy, for the quality of the pregnancy to be okay. Um, but this requires procedure. There's some planning. You need to be evaluated by a specialist, and it's costly. And usually it's not covered by insurance unless there are some health conditions. For example, a common one are people who are getting cancer treatments that makes their reproductive cycle, that takes away their fertility. And so this may be covered but by insurance, but usually not. This is something that's not usually out of pocket. The other thing I will say is STD prevention. We've talked about this on my channel numerous times. Bring the receipts, and I want. Hopefully Bishop can talk about that. But everyone in the relationship needs to bring their receipts. Receipts meaning, hey, here's my results showing that I've been tested for all these diseases and they're negative, or unfortunately, I am positive for something. This is what I'm doing to treat it, and this is how we can have a healthy and safe sexual encounter. We can talk about that later, but always consider doing that. So thanks, Princess. I just want to highlight this. So I'll end with this and take calls. Let me just, I want to make sure I add. I just want to make sure I add the link here for you guys to be able to call in if you'd like, or, to comment. But, okay, so back to this. So I just want to end with this. So this is, from my standpoint, kind of a life plan. And I'm somewhere in this region. I'll just say that. So it's relevant to me personally, right? But in general, what I'll say is that the younger, the better in terms of pregnancy and egg freezing. The younger, the better. Okay, the younger, the better. I also want to say that love is possible at any age. I've seen it in my own family and, with my own patients. This is not supposed to be discouraging at all. It's really supposed to be empowering with the knowledge, okay? So what I've done is I've just created this schematic that shows throughout the life what I think these topics should be addressed and that when. So from my standpoint, children, the best time or most optimal time, in my opinion, my medical opinion, is between the ages of 25 and 35, because we know that as people age, their ovarian reserve goes down, meaning the number of eggs, and their ability to get pregnant goes down, and the quality of the pregnancy. There's increased risk of issues in the pregnancy. So from my standpoint, with that information that we discussed and the charts we reviewed together, get it on early. Now, people can pull a J-Lo or who else? Janet Jackson, or all these, Naomi Campbell. They can do that. But trust me, they were planning. You don't stumble upon this. They probably had good medical counsel. And again, this is to encourage, not discourage. Now, if you know any person who's a professional person, share this live with them and share the slide with them in particular, to empower them to kind of start making these decisions, okay? So that's my opinion. Marriage really, of course, any age, that's your choice. Some people want to be married before having children. Some people, families come in different arrangements, and they can all be loving and respected, and I respect them. So I just put that in there, but you can, of course, can be married at any age, but as it relates to children, again, if you can do it, the earlier the better. Now, 25 to 30, I know for me that was not going to be possible. I got married at the age of 30. But if you want to be married during this time frame, you have to walk it back a little bit and meet that spouse, get to know him or her a little bit more, or whatever you decide. For me, I met my husband and we were engaged like that, but I was, more mature, older. But that's something you want to consider. So a lot of people, they're spending their 20s studying or building their career, even up to 35, okay? Next, contraception is always relevant, especially, in fact, I'm doing a study right now where I'm looking at contraception in chronic kidney disease patients between the ages of 18 and 44. And the reason I chose that upper limit of 44 is because menopause can start around 45 to 55. But my point is that, whenever you want children, if you desire children, you may want to consider contraception before then, if you're sexually active. Egg freezing, again, the earlier the better. Try early. Don't wait and say, I want children at 40, so I'll start considering egg freezing at 40 if I haven't found the person I, want to spend the rest of my life with. No, start early. If you don't need it and you get pregnant the natural way, fine, great. But this is capturing the benefits early on. Okay, next, I'll just say that's an under-recognized population of people who have issues from time to time. So I will stop sharing. I hope that's been helpful. Right. So let me see. Feel free just to go ahead and call in if you'd like, or you can comment in the chat. So, House of Princess. I'm surprised people don't want to be safe these days. Yeah. Sometimes, urges, and you just kind of rush to what you want to do before planning. And I think it's a good idea just to get it together and bring your receipts for sure. Remember, not all forms of contraception prevent STDs. Sometimes we forget that. It's purely for pregnancy. The only thing is condoms. Condoms help prevent pregnancy, and condoms reduce STD risk of transmission, okay? So yes, my pregnancy at 18 was a breeze. My pregnancy at 30 was tough. Yeah. Oh, thank you for sharing. That's quite kind of you and generous of you. Yeah, it's not easy. It's not easy. And so my only thing is just, plan and be aware. To be, forewarned is to be forearmed. I've heard people say that before. I don't remember the exact quote, but just knowledge is supposed to be empowering. And again, at any age, things are, really possible, but the risk becomes more difficult, or the risk of pregnancy becomes more difficult, or a complicated pregnancy is increasing as we age. So having children older tests your patience and is harder on your body. Really? Okay, House of Princess may know. She may know. I don't have children yet, but that is something I desire. And these are the questions that cross my mind and things that I've learned. And what I will say is, I was also raised by a professional mom and a grandmom who, not professional, but wisdom. Your grandmoms have wisdom, right? So again, these are things that are personal as a woman, but as a physician, there's science behind these decisions. And I think that every woman and man really should actually be able to make the decisions for themselves. And you can change your mind at any time, but just pivot and plan. You know what I mean? And by the way, men, in my opinion, men, I think you have an absolute right to ask your partner, have you been tested for STDs? Are you on contraception? Let me see it. You guys hear about trapping and all this stuff all the time. So yes, okay, so very informative. Thank you, Miss McKinday. I really appreciate it. Okay. Yeah, very informative. I hope so. I hope so. Again, this conversation is not just for women only, it's also for men. Um, you have rights. Everyone has rights. If you're comfortable having sexual relations, okay, then you should feel hopefully empowered and comfortable talking about, do we want to get pregnant now or ever? Do you have a plan in place? Contraception or not? Should we be using condoms? Should we not be using condoms? Right? These are normal adult responsible conversations to have. As a man, you should feel empowered to say, hey, are you on contraception? Can I see? This is how we do it. This is how we do it, right? And this is just some wisdom that we're using medical and science information to empower ourselves. That's really the goal, okay? Okay, so it looks like, again, for anyone who wants to call in the next few minutes, I'm just going to go ahead and wrap up. I really hope that this is something that's of value to you. I do plan on doing a couple of other series of videos similar to this, basically like the ultimate health plan for, the divorced woman, the new bride. There's some tips and tricks that I have, um, just from my research and my medical knowledge. But please let me know if this has been helpful or if any other questions that you may have. Also, does this time frame work for you? So I was thinking like something easy breezy on a Saturday. If you're on your way to the golf uh, course or whatever, or if you're on your way to brunch, you can listen to this in the car. Sit down with your like niece or your sister, and we can, just have a conversation. Remember, this is our platform. And again, it's been a pleasure and an honor. My name is Dr. Eva Okindaya Apia. For those who may not know me, again, I'm with an internal medicine background. Denise, that's okay. We talked about a lot. Yeah, I'll be wrapping up shortly. But again, I'm with an internal medicine and nephrology background, and really, my goal is to really encourage people to be their own health advocates, with particular emphasis on Black women, Black people. Because of the pandemic, I just felt there was so much misinformation going on. Miss Denise, I'm sorry. Yeah, it was about 10:30, 10:45 Eastern time. But yeah, we talked about a whole lot of things, but mainly the focus of the slide was contraception. Um, it was really about um, STD prevention, if you want children, egg freezing. So if you have any, questions, comments, feel free just to, join in the chat, or you can call in, or we'll catch you next time. Okay, no worries, no worries. Catch the playback. So yeah, it that's okay. So Miss Empowered Woman, love you, Dr. EVA, bring us the knowledge. Oh, thank you. And then, please definitely everyone on this live, please DM me if you have any questions. I also offer like, health information sessions. So it's kind of similar to this. It's just so much fun. It's so much fun. So just let me know if you have any topics or requests, and let me know if there's a time that works for you. I have some other really cool topics. Um, I have some cool topics. So I think right now what I'll do is like weekly lives and stuff like that. Okay. Miss House of Princess. Okay. You're beautiful no matter what time. I already know that, but that's fine. Thank you so much for your input. I would call, but I'm just getting up, laugh out loud. Okay, maybe this time is too early. So I'm just gonna review the chats and see if there was anything else that was seen. Oh, Mr. Tony Robinson, hello, yeah. I just wanna make sure I answered all questions. Planning part is key. So yeah, this is from a male perspective. Bishop and I have had conversations about this. Men should feel encouraged. Perfect. Thanks again, House of Princess. Love, love, love you. Thank you, Poisonosologist. Yeah, I think I've gone through most of these. Okay, Miss, I will definitely know that this video was very educational. Oh, thank you, sweetheart. Okay, thanks, LSW. Another good live. I appreciate it. I can't wait for the divorced woman's health plan. Looking forward to that. Okay. Yeah, she can get her groove back. Trust me. And I'll help. Miss Ramos, hey, the bishop. Okay, thanks, Bishop. So I will wrap up with that. Catch me next week. Any questions, call, text, DM me on my Instagram. It's been a pleasure. I love, love, love you guys, and we'll catch you next week, okay? Take care. Bye.